In the next step, we should collapse or block that artery. How? By that cuff you are seeing, by this cuff. This is a cuff that is around your arm and we can increase the pressure. If we increase the pressure in that cuff, it means that we push that vessel and collapse the vessel. So we collapse the vessel, and after that, gradually trying to open the valve, and it means gradually trying to reduce the pressure. At first we increase pressure, collapse completely the vessel, and then start to decrease the pressure until the vessel gradually is going to be open. At the first when the vessel is in the onset of opening, a narrow blood flow is happened in the vessel, the first sound is happened. Do you remember that slide I showed you about C point? I told you before C point we have laminar flow, and after C point, that is a blockage. C point is a blockage. After C point, laminar flow back to the turbulence. Change the turbulence and we can hear it. So it's the same thing is happened. We are trying to collapse that vessel and gradually open that vessel. When we are opening, the first flow that passes through this blocking area is the high pressure flow. Yes, the highest pressure must goes by the first flow. The highest pressure or the first sound, we hear it because it's a turbulence. The first sound, the highest pressure, or it means the systolic pressure. So the first sound that you hear is systolic pressure, like this. Please see, this line is showing the cuff's pressure, this pressure. We increase the pressure until completely collapse the vessel. It means that we increase pressure even more than systolic pressure of that vessel to collapse, block the vessel. So in the A point, the vessel completely collapsed. After that, we gradually trying to reduce the pressure until the first point that the blood flow passing through that narrow opening area of the vessel. This flow means the highest pressure. The highest pressure is passing. So the highest pressure, the first sound, or the systolic pressure. It means that when you hear the first sound by a stethoscope, you should find the pressure in the cuff. This is a manometer which connected to the cuff, showing the pressure in the cuff. When you hear the first sound, you should see pressure in the cuff. That is the systolic pressure. Then again, gradually reduce the cuff's pressure. It means opening the vessel until the end sound, the C point. C point, it means the last point that we have turbulency. What does it mean? It means that after C point, the turbulency back to the laminar one. It means that C point is the minimum pressure in our vessel, that after C point in here, after C, the vessel completely is open. The vessel is completely open. So it means that turbulency is not seen anymore. C point is the last point of turbulency. After C point, the vessel is completely and normally open. So the last sound or the minimum pressure or the diastolic pressure. The first sound and last sound. First sound is systolic pressure, last sound is diastolic pressure. And after C, we cannot hear any voices because there is no turbulence. Again, the laminar is back and we know laminar has no voice. So we have a cuff to increase or decrease pressure around the vessel. We have a manometer that is connected to the cuff and showing cuff's pressure. That it means they're showing the vessel's pressure. And stethoscope, medical stethoscope. This is a stethoscope. We put stethoscope after blockage. After blockage, we put this stethoscope and trying to hear, at first increase pressure, and then gradually trying to reduce pressure. The first and last sound is systolic and diastolic pressure. Okay, so let's see by a video this process, and we will try it in the practical session.
Hey everyone, it's Sarah Rose from NurseRN.com, and today I'm going to demonstrate how to check a blood pressure manually. First, you'll need to perform hand hygiene and gather your supplies. You'll need a stethoscope and a manual blood pressure cuff. So let's measure a blood pressure manually. To do that, we want to make sure a patient is sitting down with their arm at heart level and their legs are uncrossed. Now, if they're lying in bed, you would want to make sure that this arm is at heart level. Then what we're going to do is we are going to get our stethoscope and our blood pressure cuff. And you want to make sure you get the right size cuff for your patient's arm, because if you use too big of a cuff or too small of a cuff, it can throw off the reading. And what we're going to do is we're going to palpate the brachial artery, because this is the artery we're going to be listening to get our blood pressure, because we're going to be getting our systolic number, which is that top number, and this is the first sound we hear. And then our diastolic number, which is the bottom number, and this is the point where we no longer hear the sound. So whenever we're looking at the gauge of our blood pressure cuff, we want to make sure we're really noting those points, because it's going to tell us our systolic and diastolic number. So what we're going to do is we're going to put our cuff on our patient, and we want to make sure we find the brachial artery. This is the artery we palpate that we'll be using to determine our blood pressure. And it's found in the bend of the arm. So we're going to find it, and it is located here. And we're going to look at our cuff, and our cuff has these arrows. And because this is the left arm, we're going to make sure that this arrow is pointing in that direction of where that artery is. So you're going to put the cuff up about 2 inches above the bend of the arm. First, what we want to do is we want to estimate the systolic pressure. So we want to find that number. To do that, we're going to palpate the brachial artery, and we're going to inflate the cuff until I no longer feel the brachial artery. And at that point, when I no longer feel it, I need to make sure I'm looking at this gauge to know that number, because that number is our estimated systolic pressure number. Then when I go to take the blood pressure, I'm going to inflate the cuff 30 millimeters of mercury more than that estimated number. Now, the whole reason for doing that is because we want to avoid missing the oscillatory gap that can occur in some patients. Not all patients have it, but some. And it's usually patients with hypertension, because the oscillatory gap is like this abnormal silence that can occur, and it will throw off whenever you actually hear that first sound, which is your systolic number. So I'm inflating the cuff by feeling on the artery, and I'm going to note the point where I no longer feel the artery, which is about at the 100. Then I'm going to deflate it completely and wait about 30 to 60 seconds, and then we'll take the blood pressure. So our estimated systolic number is 100. Now I'm going to inflate the cuff to 130, and that will avoid missing the oscillatory gap if one was present. So I'm going to take my stethoscope, put it in my ears. You can use the bell or the diaphragm of your stethoscope. I like to use the bell because it's best at picking up low-pitched noises. So we're going to place that over the brachial artery. Do it lightly. Don't fully compress it, because you can occlude the artery. Then we're going to inflate our cuff to 130 millimeters of mercury. And we're going to let it fall about 2 millimeters of mercury per second. And we're listening for that first sound, which is our systolic number. Okay, it's 104. And we're listen for that last sound. And it was 78. So the blood pressure is 104 over 78. Then once you have your reading, make sure you fully deflate the cuff full of air, and you're going to take the cuff off of your patient, of course, and clean it if it's not disposable, and you will document the blood pressure and what arm you took it in. Now, what are normal blood pressure readings? According to the American College of Cardiology 2017 updated guidelines, a normal blood pressure is a systolic less than 120 and a diastolic less than 80. Elevated blood pressure would be considered a systolic of 120 to 129 and a diastolic less than 80. Hypertension stage 1 would be a systolic of 130 to 139 or a diastolic 80 to 89. And hypertension stage 2 would be a systolic greater than 140 and a diastolic greater than 90. Okay, so that is how to check a blood pressure manually. Thank you so much for watching, and don't forget to subscribe.
Okay. Okay. From first sound until the last sound, don't worry about the practicing and troubleshooting. I will work with you afternoon, okay? The practical part is afternoon. From the first sound until the last sound, we are hearing 5 different types of sound, and based on these sounds, we can say that changes of sounds is happen. It means that when you are changing the first sound as a systolic pressure, the frequency and type of sound is different until we are reaching to the last or 5th sound. In general, you are hearing 5 types of sound. At first, tapping sound and tapping like this, and then soft swishing sound like a like sound, and then creeps sound, some sounds that is with a high frequency, and finally blowing sound. It means the sound is going to be more blow, and after that we are hearing nothing. It means that after that the laminar flow is happen. Based because these sounds are introduced by a scientist named Kortkov. We said Kortkov's sound. We said to these 5 types of sound, Kortkov's sounds. It's the scientist that find these sounds, and we said we are hearing Kortkov's sound, 5 types of sound. So this is auscultatory method. We are hearing by stethoscope the changes of sounds and find the sound as a systolic and diastolic pressure. But in some cases, in hospital, in very rare cases, we are measuring by invasive method. We are directly send probe into the aorta. For example, if somebody has a very much bleeding, or the pressure in the patient is very low, we cannot find the pressure by these non-invasive methods. We are trying to send a probe through the hand into the near to the aorta and monitor blood pressure changing directly. That is a non-invasive, and usually we didn't do that. We are didn't doing that, and we are generally using these non-invasive methods. In parallel with auscultatory method, we have large numbers of blood pressure instrument which automatically measure blood pressure. In the home, maybe you have one of them. They are automatically measure blood pressure. How they automatically measure it? The sound by the instrument is detected, and these sounds by the instrument detected, and instrument find the first and last sound. It means that it's not manual. We are only put the cuff around the hand and press the button. The button at first increase the cuff's pressure, then gradually trying to reduce it. The founded sound are detected by the instrument, by this instrument, and this is automatic method. But I suggest you to try and practice the auscultatory method. It means you try to hear the first and last sound by yourself. It's too interesting to you if you try it, okay? Don't rely on the automatic method. Okay. Any question until here? No?
Can you determine the last sound and the first sound by the manometer? Doubtless,
How?
by the lines of
No, you can use it by your hand. For example, if you put, instead of stethoscope, put your hand on the pulse area, okay? So increase cuff's pressure until you feel nothing on your hand, on your finger, sorry, and trying to decrease cuff's pressure. And in the onset that you feel pulsation, it's considered as a systolic pressure, approximate systolic pressure. But you cannot measure diastolic pressure. Only by this touching method, you can find systolic pressure. In some case, if you have no access to stethoscope, you can use this touching of the wave of vessel and find only systolic pressure, okay? And we know that if in an emergency case, if we have no stethoscope, systolic pressure also is important because diastolic pressure is after systolic pressure, and systolic pressure as a highest pressure is more important to us, yes?
If we can't find the vein, what is the solution to measure the pressure?
To measure the
Pressure. For example, if I put here and I start to increase the pressure, but I can't find the vein, what is the solution?
the vessel,
Yeah,
the
the
arch.
vessel, yes.
Okay, we are measuring arteries pressure. Veins pressure is always very, very less, 1 or 2 millimeters. Try with wide little in here, in the ellipsis, not ellipsis, that you have to see. So it means the practice helping you to find it. There is no way to not find it. If some patients refer you, you have to find it.
Because some patients, the vessels become so deep.
So you have, and after a while, you know the area, the proximal part of the brain. So, my dear friend, the remaining part is about veins structure. Until here, we know that vein has high distensibility and high compliance. So, and on the other hand, the huge volume of blood